Hello, everybody. Whoa,
Welcome back to our Side Lifestyle Podcast. If you're listening to this on audio only, you should go to YouTube immediately and just take a big gander at Aram's throat and all his tattoos just peeking out, his giant medallions. I'm Batman.
My son would love it. He's like into the Batman Lego movie right now. He would
Oh, he
just
is?
like lose his shit.
The one with Will Arnett. That's
Will
a good
Arnett
movie.
does a good Batman voice. It's very nice.
Oh, he's perfect. So Christine and I'll let her introduce herself in a minute, but her and I got to talking on Instagram after I had posted something about how there is a need for Western medicine and how we can't just rely on nutrition and fitness to fix every problem that a person has from a medical standpoint. And her and I got into a great discussion. She shared some anecdotes about her work that she does in critical care, and I wanted her to share some of her stories so that we can truly start to bridge the gap between the different types of healthcare that exist so that people understand when to use which tool for which job. And I think it's a wildly important discussion. So, Christine, tell us about who you are, what you do, and we'll get going.
All right. My name's Christine. I am a registered nurse. I currently work in a pre-op and PACU setting. And for those who don't know what PACU is, it's just post-anesthesia care unit. And then my time prior to being in PACU for these last couple of years was spent in a critical care setting. I've worked in the hospital since I was 19 years old. I was a tech before I was a nurse. So I've been around it for a long time. I'm 37 now, so you can do the math.
And you've gone through your own functional health journey as well.
Yes. Or like at a point in time where I utilized a functional medicine practitioner because I wasn't getting anywhere with a primary care practitioner. But I think some of that, it's like in being in the medical field, like there's certain things that I know what to look for that maybe like the lay person would not, or like I know what to take for gospel and what not to take for gospel. So I think that helps where the lay person, they just may listen to, whatever spewed their direction and not be able to kind of wade through the BS. So
yeah, and don't worry, we're a swearing friendly crowd here, so you can let it rip.
Okay, it's pretty bad sometimes.
No, trust me, it gets bad here. So you're in good company.
Fucking bullshit.
Exactly.
We got it out of the way.
When it comes, like you were telling me some crazy stories, and I want you to share some so people just get an idea of like what really happens behind the scenes. And like there are truly people that are refusing medical care and then dying because of it.
Yes. And sometimes it's not because they want to go like a, foo-foo alternative route. Sometimes it's for religious beliefs. And in the case that I saw where somebody like actually ended up dying, it was because of their religious beliefs. One of the things that we, ask people in the hospital is if they are agreeable to receiving a blood transfusion. There are certain religions like Jehovah's Witness, among others, that will often refuse. And normally it's not a big deal, right? Until you are in the thick of an illness, like you're bleeding out in my ICU kind of situation. This particular individual, we ended up finding out later that they had some sort of malignancy. And this is why their counts were so low on top of the bleeding. But they basically had their whole congregation in there, like making decisions for them.
Were they conscious?
They were conscious. He was alert, oriented. He was on the younger side, but still of age.
Okay.
Yeah. And he didn't have any blood relatives around. It was strictly like people from the church. And it was tough because at one point I felt like he was being pressured, and I did ask everybody to step out of the room so I could speak to him like on his own. And he was still opting not to receive the transfusion. And he ultimately died because of it.
It's wild to me. I mean,
So.
At the same time, it's like if this is something that there's things that people are willing to die for.
Right.
Like and if that's something that someone's willing to die for, to not allow any of that, then more power, less power to them. I don't know.
I think that's less power.
Well, and it's like, what if all those people, like in my mind, it's like, what if all those people hadn't been around and weren't like influencing? Because there are people that'll flip the script like once everybody's out of the way and they're like, can you do this and not like say anything to anybody? It's like, sure. Like this is your medical care.
Have you had that happen?
Yes, on occasion. And it's usually not something that like dire, but
okay. Where like they tell you specifically like don't disclose that you did whatever procedure.
Yeah.
Interesting.
Or don't share any, the person who's picking them up. Like in post-op, I usually have to do instructions with whoever's taking them home. And maybe it's a neighbor or, somebody who's not a blood relative that they're like, please don't disclose X, Y, or Z to them, and it's like, okay, not a big deal.
That makes sense.
But, and then like with the blood transfusion stuff, it's interesting now in like the wake of COVID, again, before somebody has surgery, we always have to ask them, are you open to receiving a blood transfusion? And now one of the questions that we get fairly frequently is, well, can you make sure that if I do get blood, the blood that I get does not come from somebody who's had the COVID vaccine? And I'm like, that's not how this works. It's like you're open to receiving a transfusion in the event of an emergency, that it would save your life. We don't just go around like giving out blood like it's candy. It's only going to be if you need it. But no, I cannot tell you if the blood that you're getting from somebody, like if they've been vaccinated or not.
Do you see that potentially being in the future? Like, let's just say they found it. Do you see potentially in the future, could blood from somebody who's vaccinated and we find out there's an issue, could that be something that affected somebody who received it? Is that something that you could see potentially one day being like, yeah, you're going to get this or that?
I don't know, because I mean, when we type and screen everybody for like antibodies and those sort of things, and I don't know how, like on a like what specific level it like breaks it down. I know in terms of like if you got blood from somebody who, let's say, was vaccinated, it's not enough that you're gonna like acquire and keep that immunity. So there would have to be like good record keeping of like almost like a registry of like, this is who got the vaccine, this is who's donated blood. I don't know that there's like on a cellular, like molecular level that they can break it down, at least right now, to be able to tell those kinds of things. So,
and I imagine there's probably no like intake like I haven't given blood in a long time, but I imagine there's no like intake process that asks you that question, right?
The last time that I gave blood, that was not a question that was on there.
Yeah. Well, and again, like in the circumstance where you're like, it's either life or death. Like, let's say,
like, are you willing to die for that? Like,
right. Like, let's say there are arguably potential problems that are going to occur downstream from receiving vaccinated blood. Deal with that when it comes. Like, that's another bridge to cross when you get there. It's either you're going to die right now on the table, or you're going to deal with fucking whatever heart condition is going to come later on. Let's try to deal with the bigger problem here, and that's why I think I'm watching people in the health space now again, it starts to become politicized and polarized as opposed to it being science. Like there is something to be said for we have best use cases in place, we have best practices in place, we have standard operating procedures in place. And what you were saying before, there is certain levels of gospel to science that we just have to take your word for it and hope for the best. Now, doctors fuck up constantly. It's not a surprise. It's a extreme situation. Stress is high. Not everybody's perfect. Maybe not that guy. That guy could have had a bad day.
I think it's the number 3 leading cause of death in America is medical error.
No, number 3.
Number 3.
Is it? What is it? Heart disease is number 1.
I don't know. I think medical error is number 1 and 3.
I think overdosing on phytochemicals is number 1.
It's probably oatmeal.
Yeah, it's oatmeal.
Oh, yeah, the inflammatory oatmeal. That's what I was told.
Yeah.
But it's
There is
like,
inflammatory oatmeal.
in those cases, I find it to be so sad that people will just blatantly disregard the fact that they need services. But, God forbid, like somebody's having a fucking horrible staph infection, or they get into a car accident and they break something. Like, there's not going to be a functional medicine professional that's going to be able to help you with that problem in those acute emergency situations.
But with enough protein and amino acids, your bones will heal themselves.
Exactly. Almost immediately from the time of impact.
That's what I think we need to understand. If you stay hydrated and you get enough protein in,
you're fine.
Take athletic greens, the bones heal. If you eliminate sugar, cavities fill back in. There actually is research for that kind of stuff, but
and let's also I've seen plenty of people in the functional health space, especially on Instagram, who will literally say things like and blatantly, I'm not going to name names, but blatantly say, I know more than your cardiologist knows.
Like who?
I'm not going to say. I'll tell you later.
Yeah, but specifically, you don't have to tell us, but tell us just a name.
Specifically, go fuck yourself. But
who?
But here's the problem, right? Like when you're talking about highly dysregulated blood sugar issues, or severe stroke risk, or things that are really diagnosed by an actual blood panel, right? Things that need to, maybe there is, do we over? I mean, I'm sure you can talk about this too. I'm sure you probably see a lot of over medication happening. And I don't think any of us are void of that concept. I'm sure there's an incentive to over medicate. People make money off of it. It's an industry. It's for profit. I get it.
Well, the interesting thing is at least in the primary care space. So, and I think, who Spencer Nadolsky is.
Yeah.
Okay. So I think he's posted the link to this where you can actually go and see what your primary care physicians or physicians in general are getting paid in terms of are they getting catered lunches? Are they whatever that they're making? And the funny thing is vaccines are a hot topic, right? Especially for children. And you'll go, pediatrics is one of the lowest paid specialties. And you can go to your your pediatrician's little thing on there, and it's they don't make boo from pushing any of that. They're not doing it to.
Interesting.
I will say, because we've got some of this stuff. I'm a teacher. I've been a teacher 24 years, and we have some drama in our district right now. And one thing that apparently happened a few years ago, because there's software is changing on what we're using and all this kind of stuff. And every handful of years, you're getting a new bid for health insurance. And school district, you take the lowest bid. Apparently, they did not take the lowest bid. They took a different bid. And why would you? Because somebody's receiving cash, literally cash. Somebody I know whose husband worked for the company who gave the lowest bid, didn't get it. It's they're getting thick envelopes of cash. Because I'm always there's got to be kickbacks here. Why do we keep changing the grading software? And I'm but how are they getting kickbacks? How does that work? Where does that money go? And how's it not tracked? And she was cash. Straight up wad of cash. Take our software, pick us, whatever it might be. Wad of cash. So it's you do wonder, does that
Oh, and I'm sure that it happens, and I'm sure that it happens in the medical space, 1,000%, but not for the things that, you hear people screaming about, the Baja people and those sort of things, but the anti-science people.
Right. And so when we talk, you were referencing the idea of there are just some definitive things that we just need to be able to accept. This is the truth. It is what it is. What would you say, what falls into that category when it comes to medical care? Where do you need to just be able to just say, hey, I need the medical system for X, Y, Z?
Like you alluded to, you come in as a trauma, you have broken bones, those things are not going to fix themselves. Severe infections. And we kind of talked about a situation with that where I had a patient in the ICU who, the patient was severely, severely ill, and there's certain things that you have to react to, and you have to react to fast before they decompensate further. And when your blood pressure's 60 over dead, and I have the family asking me like, well, I heard that onions draw out toxins, so can I put them on their feet? I'm like, you can sure do that, but that's not going to help in the now. They need little squeeze on their vessels. I need to give them some medication that is going to help bring up that blood pressure. They need fluids. They need antibiotics there before they go and meet Jesus, because we're about 3 seconds from that happening. Like, these are things that you are not going to fix with, strictly just homeopathy or like whatever alternative measures. If we are already in this space, you are already in the ICU. There's not a lot of wiggle room.
It's wild that somebody's going there and then saying no.
Right.
Oh, that happens all the time.
Like all these examples, though, like it's like, why are you there?
Right.
Just sit at home and rub onions on your feet. Why are you going in and then saying, I don't believe in this? Well, why are you here?
Well,
I can't drink enough water. I just figured I needed an IV. I need to get hydrated quicker, and I'll allow that. I don't get it.
It happens all the time. And I'm just like, do you want this paper that says you can leave against medical advice? Because I've got stuff to do, man. Like, let's go.
Yeah, I've never gone to the hospital and refused what they're offering. I'm going when I need to go. Like exactly what we're talking about. Right. I can't imagine. Are you just going in there to be like, I know more than you?
Some people, yeah.
I just want to let you know.
And in that particular instance, I don't think they were gunning for like instead of. I think it was like, can we do this in addition to? And it's like, we sure can, but like, you got to move out of the way and let me do this stuff first. Otherwise, Grandpa's going to go meet Jesus. And I'm like, but sure. And so literally we let them put the onions on the feet.
Oh, they did it?
They did it. It stunk up the entire unit.
So I just want to paint this picture. They went to the hospital for an issue. They brought onions. They asked if they could do the onions, and then they did the onions.
Well, they brought them from the outside once they realized how grave of a situation was going on.
But what I'm saying is, did they show up initially with the onions, or did they run out and get onions? I think
they ran out and got onions.
Very important picture to paint. So they go to the hospital, they find out some info, and then they ask, can we do the onions thing? And then they run out and get the onions and bring them back. When did they find out about the onions? Did they Google it while they were in the hospital? If so, like, it's just insanity to me. Like, if you knew this ahead of time, why didn't you bring them with you? Number one. And if you were going to have that be a solution, why not just stay home? This is insane.
Instacart.
It's like, oh, they're in there and they're Googling like their favorite functional doctor. And they're like in the hospital, and then they find out, yeah, onions on feet. All right, we're going to run out. At least that makes sense to me.
Yes.
I need all the details of this situation. This is wild.
I'm so sorry. I did not ask them if they were like Google. People do sit there in the rooms and Google all the time.
Now you know. Lesson learned.
Find
out. Now, did you know about the onions before you came in? Yeah, like that would be the first thing. And they're like, well, yeah. And they'll be like, then why didn't you try this at home? Well, we did, but it wasn't really working. And you want to try again? No, we did it. We didn't want to bring it. Why didn't you bring them if you knew about the onions? And it's like, you at least can make them look stupid. You know?
You could. You could.
No, we just Googled it. So you're in the hospital for an emergency. You decided to Google, and you saw this as a possible solution, and you thought, that makes sense. Let me go against doctor's orders and run out to the store. Did they get organic at least? I'm hoping they got
you know what? They didn't share that information with me. And I was just trying to stay out. I hate onions. I was trying to stay out of that room unless I had to be in there.
Oh my God.
And like, Christine, I feel bad for you because like there are people, like you're sitting there, you're overworked, you're underpaid, your sleep sucks. You're having to deal with fucking stupid people on an hour-to-hour basis that are usually self-inflicting these problems onto themselves. or it's because of years and years of self-neglect that's put them in this place.
Which is still self-inflicted. Yes.
And then you're trying to do the best you can. And then what I think the other thing you alluded to in our conversation online was that people are just blatantly shitty and rude to you on top of that.
Yes.
Like,
just 2 weeks ago. Yeah. And it's unfortunate. It's like, we're there trying to help you. We're not like, I don't show up at work and, you know, be like, well, I'm going to do X, Y, and Z because this benefits me. Like, nothing that I'm doing is benefiting me. It's benefiting you. And
right.
by all means, there's the door. Like, if you're not happy, if you're like, whatever it is.
What happened 2 weeks ago?
It happened. Yeah, I think it was like 2 weeks ago. My endoscopy team brought me out a patient that they warned, in all fairness, they warned me. They said she was a little rough in pre-op. She didn't want anything touching her, which in our department, like, you're monitored. You got the heart monitor, your O2 monitor, blood pressure cuff. There's a certain parameter of time that we have to monitor you after you've gotten general anesthesia, sedation, those kind of things, for your safety, right? There's certain criteria you have to meet to go home. And so they're like, well, good luck. She's going to want all of this off. And usually I'm pretty good at like convincing people to keep their stuff on, but she woke up like, yeah. Well,
manipulating them with your medical terms. Bought by big doctor.
Yeah. They don't pay me enough. I can tell you that for free. But she woke up, like, sat straight up, started ripping her little pulse ox off. And I was like, hey. I'm like, what's going on? Like, you're just waking up. And she's like, I want this off. And I'm like, okay, I understand that. I'm like, we do typically have a period that we have to monitor you for. Can I at least finish getting this one set of vitals on you? And because I don't mind throwing a note in the chart. Patient told me to fuck off. You know, he wanted to leave. Like, you laugh, but no, we put it in quotes in there, per patient. And
that's awesome.
So I get my final set of vital signs. I call, make sure her ride, because part of the thing, like, is you have to have somebody who hasn't had drugs drive you home, right? Or we think that hasn't had drugs. Let me preface that. The area that I work in, it's dicey. So I call, make sure her ride's there, get her paperwork. I'm like, let me go at least print your paperwork. That buys me like 5-10 more minutes. And then she hops up. She verbally threatens my patient care tech because I say, hey, it's policy that everybody goes down in the wheelchair since you've had sedation. And she's like, me and Ellie are going to fight then. And I'm like, oh, okay. I'm like, Ellie, I'm going to have you just like, we're done here. Like, we're done. And she starts to try and walk towards like where the operating room is. I'm like, ma'am, that's the wrong way. Here, let me walk you out to the elevator. And I walked her out to the elevator and bid her adieu.
Why did you trip her as she was getting on the elevator? That's what everybody wants to know.
Did you see that?
Yeah, I feel like you crossed the line with that.
I don't understand it. Like, it just doesn't make any sense. Like, the times that I've been in the ER, like, I've needed to be there, and there's no questioning. There's no like Googling of anything. It's just like, my life is in your hands and I trust you, and whatever fucking happens, and I'll deal with the aftermath afterwards, because the state that I'm in right now, I'm not sitting here and questioning if you told me to sit upside down backwards and eat my own feces, I would do it, because I'm in your hands.
It sounds like Aram is struggling with critical thinking skills, comparing functional with medical. So it's just good that we're having this conversation. He would literally just listen to a doctor that told him to eat his own shit.
Yep.
This is the problem with the people today. They're not good critical thinkers. Were you going to say something after you said I bid her adieu? Were you about to say something after that?
Oh no, I put in my little note, my note with quotes, and patient verbally assaults patient care technician. This RN advised her of like, this is the policies and procedures. Patient counseled and walked to the elevator by this RN.
And you put in there, she tripped on her own. You put,
The drugs
door
made her do
door
the
door
drugs
the door hit her on the ass on the way out, subsequent to
squeezed her
her
ass. It just kept going boing, 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 boing.
leaving the facility. So to switch gears and to talk about when it does make sense to question when Western medicine, like obviously, like you've gone through your own blood work stuff and everything else. When does it make sense to start to seek these other alternative opinions?
Like in my case, it was I wasn't getting any answers. I was kind of getting written off. And I do think that like a lot of people feel that way. And that's when they start to seek out other answers. The difference being like, I can look at clinical data and kind of wade through the bullshit that they're telling me versus like what I see on paper. And I don't think the general public has that, you know, the ability to do that sometimes. So, but for me, it was, I was telling Aram, I had a doctor, basically, I went in, I was having these symptoms of like I was like cats on a tin roof. My blood pressure was through the roof too. I would like cry at the drop of a hat for no reason. I would just snap on people. I would be like shaking at work. Like if there was kind of like an anxiety driven situation, I would like shake. I'd be shaking as I was charting. And so I went to a primary care doctor. And granted, this was a first visit with this person. And I look like a mess. I'm like crying. I'm like, I don't know what's wrong with me. I don't know what's wrong with me. I'm like, can we do some lab work and see? Because I had a feeling it was my thyroid, but it actually ended up being like the opposite of like what I thought. And he looked at me and he's like, I think you just need to go to therapy. I was like, oh, that's interesting. I'm like, what am I going to tell them?
This is before getting blood work. This is in response to you being there.
Yep. And I was like, what am I going to tell them? I'm like, I have a beautiful son. I have a job that I like most days. You know, like I have a great life, great husband. Like, what am I going to tell a therapist? I'm not like depressed. You know, these are like, I'm having these actual clinical symptoms. And so I went and I sought out a functional medicine doctor specifically because I know they'll run a battery of tests. And then I can like wade through that data, right?
Yeah.
So
they're doing a GI map for anxiety.
Yeah,
get it all here. Shit in
it's
the
all
cup.
the bad bacteria.
We'll find out what's wrong with you. Yeah.
And that's where I think understanding how to use these different tools appropriately makes sense. Like if you're dealing with something like when it pertains to health optimization, like I'm not trying to just not die next week. I'm trying to live as long as humanly possible, as well as humanly possible. I don't think Western medicine is equipped to handle that issue because that's not their responsibility. Like their responsibility is to make sure that your chances of dying immediately are not severe, or to repair some system that's acutely very, very damaged that needs to get fixed now, life or limb. And that's what they're really good at. But if you go to your general GP doctor and you're complaining of high blood pressure or symptoms that seem like they're anxiety driven, well, their responsibility is probably to start doing some type of diagnostic work, I would imagine,
right.
as opposed to just dismissing you and telling you, hey, like you have a mental health issue, which sure, you very well may have a mental health issue, but at least like kick the tires and check under the hood first.
Well, and that was the other piece to this is, so my mom does have some mental health issues. Like I don't speak with my mom anymore. Because it was like years of the same cycle of shit. And I'm like, I've got a kid now, like you're in or you're out. You can't just like disappear for 6 months and then show back up and act like nothing ever happened. But that aside, so I was worried that with some of this was going on, that maybe it was like, you know, like I was just like losing my shit, and that I was falling down that same like path, because I'm pretty sure she's like bipolar, borderline personality, something like that. And so I was worried, and that was one of the things, like the functional medicine gal, there were some labs that she ran that she's like, certain things tend to be elevated in people with this condition. and yours came back completely normal. So I don't think you have to worry about that. At least not right, not right now. And it was my thyroid. I was hyperthyroid and got on some medication for that, and it helped.
Ginger root?
No,
Ginger root?
no actual
Is it
medication.
oil of oregano?
Yes,
Okay.
oil of non-bipolar. No, I'm just kidding.
What did they give you to treat hyperthyroid?
Methimazole.
Okay.
So, and I'm off of it now. She thinks it was kind of an acute thing, and now I'm monitoring labs every 3 months for a period of time to make sure that I don't, swing back the other way. But
so were they like, hey, like, you're going to take this for a little while, we're going to monitor you and make sure that if it starts to get better, we obviously don't want to keep the drug in the system for longer than it needs to be?
Yeah.
Okay.
Yeah. But I think you bring up an interesting point too, in like the model of medicine. And I remember specifically in nursing school writing papers about this too, of like a disease-centered model versus like a preventative care model. And that like we need more of that preventative care model versus just like the disease-centered approach. And I think that that's like the piece that's missing. And I don't know that it's just big medicine's fault. I think some of it stems from a lot of different directions. So insurance companies, the coverage they provide or don't provide, socioeconomic issues in relation to, can I afford care? And I think that's a big driver, because that's what will bring people to the emergency room for what should essentially be something you'd go to a general care practitioner for, but they can't afford it. And so in the ER, they have to treat everybody, right? So I think that plays a really big role in it too.
Yeah, I mean, it's so multifaceted, and I think you can't just sit here and say the system is broken. You have to say that the system has a ton of inefficiencies in it, and there's so many different factors that are weighing into a person's ability to get care. And let's be honest, like, the functional health space is expensive as fuck. Like, it's not cheap to go and get
They
a
don't take
battery.
insurance usually. Like this lady, she didn't take insurance.
Right.
Yeah.
So like you're out of pocket. And to me, the way that it works is like the people that are seeking out functional health are probably the ones who can usually, I mean, I'm going to make the conclusion here. They're usually the ones that are worried about the stuff that they can afford anyway.
Right?
You know what I mean? Like you're like the person who's looking for fat loss or body composition improvement. They have the luxury, so to speak, to worry about that kind of stuff. Whereas the person who can barely afford even basic access to healthcare, do you think they're worried about losing fucking 20 pounds by summertime? Probably not. So it's a completely different conversation in a completely different realm. Like if you're somebody who's sitting there and saying like, well, I can't lose fat. Well, okay, how much fat do you want to lose? Well, I have 150 pounds to lose. Well, you don't need a functional medical fucking practitioner to run blood work and GI maps on you to say that you're 50% body fat.
Right.
Like start walking, start eating vegetables and lean protein. You'll probably be okay in the next year and a half. And I'm sure your blood pressure would go down and your blood glucose would probably go down. You'd have less disease risk, period. But the person who's 147 pounds who wants to be 142 for whatever fucked up reason that we can't conclude, sure, if you want to spend $700 on blood work and a GI map test and you want to go down the supplement and hormone replacement route, shower in it. I don't give a fuck. That's what those people are there for. That makes total sense to me. If you want to pay for all that stuff, go right ahead. But I think it's where is that middle ground? That's the hard part. And I think there is some responsibility on the individual. I think there's a lot of responsibility on the state of things and the government and stuff, and to make these things a little bit more accessible to some degree, which you and I will never be able to change, not in our fucking lifetime at least. So it's a very convoluted, very messy conversation that I think unfortunately evokes so much emotion from people. And that's where the conversation gets heated and there's blame and there's polarization, as opposed to being like, hey, everything has its purpose. Like there's a tool for a job, and understand that when you're suffering from something that's really destroying your quality of life and you've exhausted all your natural remedies that you can possibly do on your own, then it makes sense to go to somebody who might dig a little deeper.
Right. Well, and to your point, like the people who can't afford to do those things, a lot of times are unfortunately at a disadvantage for many, many reasons. Those are the your lack of a better term, like lower socioeconomic patients, your minority patients. Like I did a lot of work. I worked for the county hospital for a couple of years, and I worked and served that population, and those are the people who like they need the most. Like they, from a health literacy standpoint, sometimes it takes a little bit more, and I feel like sometimes they're just at a disadvantage and don't get what they need. And so it just kind of snowballs, right? Like if you're not getting the preventative care that you need, you develop comorbidities, the hypertension, diabetes, all these things, because you couldn't afford to go to the doctor, you couldn't afford the medications that you needed to be on, or so on and so forth. And it affects them disproportionately.
And I have I have an ER doctor who's a client of mine, and he's told me multiple times. He's like, I have people that come in who are not quite morbidly obese, but let's say they're just in the obese category, who are given medications that they can't afford through either Medicaid or Medicare or whatever, and they blatantly just don't take them, or they don't refill their fucking prescriptions because of just personal irresponsibility.
There's that too.
And there's that problem as well. So it's like you are getting care, but then when you're given that care, you don't follow up with it and you don't do anything about it. So it's like there's, and I think with somebody like an ER doctor, he has what, 20 minutes to do what he's got to do, and then once that person gets switched over from the ER to somewhere else, to ICU or whatever, or to getting put in a different room, and now that person doesn't even have the ability to speak to the individual and say, hey, losing some weight would help. Eating a little bit better would help. Doing some exercise would help.
Yeah, but even then, you'll get people. There's a doctor in town where I live who has all these negative reviews because she brings that shit up. And people are like, I didn't come in to tell me to lose weight. I came in for you to, and people get pissed. And some people are like, it was great. Like she called it out the way that she should. But a lot of people don't even want to hear that. Even just like the doctor gives you a prescription, you don't take it. The doctor gives you actual real functional advice. This is what you need to do. And not only are they not going to listen, but they're going to be offended by it and feel that they were, prejudiced against.
Well, and I wonder sometimes if it's the approach, because I get what you're saying. And I can think of a specific individual that I work with that's an anesthesiologist that from outside, I talk to my
it well. She says it like rude kind of a thing. You need to lose some weight.
He's fat phobic. Let's just call it what it is.
So there's
there's a little disordered, steps on the scale every morning 15,000 times in pre-op.
How have you not fucked around with the scale at this point? I just don't know what's going on in this hospital. You have to add you gotta throw the tear off a little bit so he thinks he's up 3 pounds.
Oh my
God!
He
mess
would
with this
lose
dude.
it. He would lose it.
What is wrong with you people in there? Come on, you got people rubbing onions on their feet, and you're not messing with the scale obsessed guy who's a douche. Come on, let's get on this. Let's make this guy.
He is good at his job, but I'm like, the way that he comes across, I think sometimes to people when he's like, you could lose weight, it's a little off-putting.
Yes.
Yeah.
Wait.
I agree with the delivery should be done a certain way. Absolutely.
His role is as an anesthesiologist.
Yeah, he's an anesthesiologist.
So why the fuck is he making commentary on anybody?
Because of how much drugs he has to use for somebody who weighs more. Aren't you more at risk as well?
You are more at risk. You are typically if you have a larger habitus, The opportunity that you have sleep apnea. Is there your general overall like body shape, the size of your neck? Those are all things like as part of like the sleep apnea questionnaire that they kind of look at to assess risk. You're more likely to have airway issues, be a little bit more difficult to extubate, sometimes more difficult to intubate, depending on these things. So, and then obviously higher BMI, you are at a higher risk going into surgery, like period, the end, like for complications. So that's why these things are addressed. But it's just, sometimes I think it's the delivery.
Yeah, I agree. Absolutely.
Little bedside manner.
Yeah, no doubt.
What's that? What's that?
Especially if that's what you're going to be telling somebody. You should be very aware of how you're saying it.
Yes.
You know, I mean, that's, if you're a douche, you're a douche. You can't, you know, I mean, there's no excuse for that.
Christine, do you see doctors in your world actually having these conversations with patients after the care has been given? Like, are they actually sitting down with people and saying, hey, there are things you can do from a preventative care standpoint?
So yes, I typically see it before surgery, because after surgery in PACU, nobody remembers when anybody talks to them. Half the time they're drugged up. But yeah, a lot of times some of our like surgeons, some of the anesthesiologists will have these conversations with them, especially if a patient comes in and maybe this happens frequently, their blood pressure is elevated. And they say, hey, did you know that your blood pressure's high? Like, are you being treated for this? And that usually starts the conversation. Hey, you need to go see your primary care physician about X, Y, and Z because this occurred while you were here today. You know, the blood pressure being high. That's probably like the most common one that we see. And then like things that you can do to change that. And like for me, instead of being like, you know, you need to lose weight, or, you know, I do tell them, I'm like, you know, obviously weight loss is a big component. You know, diet, exercise, those things, the things that you can do and that are within your control, because if you do not control those things at some point in time, you can develop other complications, right? Like you can end up on dialysis if your blood pressure is elevated for long enough, untreated. You're not doing anything, whether it's medication, diet, lifestyle, whatever it is. So I like to do the like, here's what life would look like if you don't do these things. And I like it, kind of like scare them a little bit, but like in a nice way.
But I think that's great, because at some point, like there is rock bottom could mean death.
Right. And I'm like, and I don't know if people like
rock
understand
like
how
the misery of not dying in my mind, like the 20, 30 years of dealing with this shit, because all you're relying on is medical intervention, and you're constantly in and out of the system and just on like, it's just, you're not even living life.
Could you imagine being on dialysis? Do you know how like intensive that is? That's though there's multiple ways to do it, but like typically it's Monday, Wednesday, Friday, you're going and you're running for X amount of hours. So you're having to carve all this time like out of your week to do these things. Think about trying to go on a vacation. Like you have to pray that there's a dialysis center to wherever you're going and set up stuff with them. And like, do you want to do that? That sounds awful.
I don't know how Osama bin Laden did it.
Was he on dialysis?
Yeah.
That's what they want you to believe. You're just another tool of the government, Aram.
No. Osama was on it.
Is there, Christine, anything where, say somebody's listening and they're like, I'm pretty healthy, and they don't even have necessarily any symptoms, that you would say, hey, this is something maybe as you're getting older that would be a good idea to check out in a preventative way, or like any test outside of just getting routine blood work done? Is there anything that you recommend from your experience?
So colonoscopy, not that anybody wants to hear that.
I get them every month.
I do it for fun. So yeah.
Does Aram do it for you?
Yes.
He does.
Yep.
He does.
We do something called an oral colonoscopy.
We don't use any medical equipment.
Gross.
He has a Super Soaker 6000 and pumps it up, and
that's it.
That's it.
That's it.
I still haven't had that done. I'm gonna be.
You've never had a colonoscopy?
No, I haven't even had my prostate checked yet. I'm gonna be 57 in 2 weeks.
Well, 40 is the new 50 for a colonoscopy.
I know. That's what they tried telling me. I'll pass. I'll wait till 50. My brother did get it last year, or the year before, and he's like, there's some polyps, and he's like, guys, you got to get it. You got to get it. I'm like, I know. But yeah,
so colonoscopy, what else?
Colonoscopy, your routine blood work, making sure that you're going and seeing a PCP yearly for said blood work.
Yeah, so you can get freaking referrals for when things do come up. Like
that
even
too.
that, like I ended up in the hospital with pericarditis, and I was supposed to go to this heart house and have an EKG stuff that I didn't see my general practitioner in forever. So they would not see me. I had to make an appointment with my general practitioner, which I did not do. That was a year and a half ago. And to be able to go to the heart house. So maybe one of these days I'll get my heart checked out. But
well, and then it's like getting an appointment, right? Like they're like, I can see you 6 months from next Tuesday. And you're like, what the hell?
Yeah. That's the hard part. But yeah, I mean, I think like routine checkups. I was talking to a client of mine today, and she's like, yeah, my husband snores, and I've been trying to get him to get like a sleep apnea machine, and he won't do it. He hasn't seen his
primary. Girl,
in,
preach.
Like 7
I got
years.
One of those too.
Right. I'm like, it's now disrupting your quality of life because you're not going to bed and sleeping well, which is fucking you up. And there's we all know the issues that happen when you're not sleeping well. And it's such an uncomfortable conversation to get somebody to care about themselves enough to do something. And I get it. Like, you're jumping through hoops. You're getting on the phone with people who can barely speak English or that are fucking writing you off. And it's a pain in the fucking ass. And I get it. But, like, there's merit to it. It's going to help you at some point. Like, I'm guilty of it. Like, I've been in California since 2021. And I just got my teeth cleaned the other day professionally because I didn't want to pay for fucking dental care.
It's funny. I was going to say something last week when I saw you here on they were looking
good. Looks rough. Great, right?
Yeah.
Looks good now.
We all have different adjectives we can use.
Sure. But and I understand the nuisance that it is. I don't ever want to discount that it's a pain in the ass.
Yeah.
But if that 17-minute phone call and then that 30-minute drive is the thing that tacks 10 years onto the back end of your life
and saves you time, like on a dialysis or all these other things. Right. They're going to cost time and money later on.
Well, and then like sleep apnea, it puts you at higher risk for stroke and heart attack, which me telling my husband this, I'm like, good thing we just did our will and trust and all these things because you might drop dead next week. I'm like, can you just go get a fucking sleep study?
Yeah, you had the kid. Get the 20-year multi-million-dollar life insurance policy, the term life insurance policy. It'll be cheap for you,
We're
and then
both
at least
worth more dead than alive right now.
Yeah, it helps with the mourning process. That's really what you need.
You move on You move on faster when the check is bigger.
Yes.
Always, 100%. If there's any medical advice that I can ever give, is if you're a spouse and you're dealing with issues with your spousal care, just make sure that their policy is high, make sure it's liquid, and make sure that it's paid out immediately. So that way, the grieving process is shorter. You can move on immediately. Then you can get yourself taken care of. You can go get that functional medicine stuff get done. You can get on Ozempic. You can get a nice little dose of TRT, and before you know it, you're back out on the market, 50 pounds lighter. Your husband's gone. The kids are taken care of.
A little BBL. Tummy tuck,
perfect.
My house could be professionally painted. My husband's on the roof right now. He actually just asked me today. He's like, the life insurance policy's paid up, right? And I was like, yeah, please don't fall off the fucking roof. I don't want to go to work today. Like,
it's
I'm
paid up, but you got to go give him a little push. Get that payday, Christy. Get that payday.
Is he wearing a set of your heels up there while he's doing it?
Maybe I should go give him some.
Yeah, like I've heard that this helps with painting. Studies show. Well, listen, I don't want to take up any more of your time. Do you have any parting words for our audience to make sure that they take better care of themselves?
Man, just do what you can to stay out of the hospital. Go get your yearly checkups. Go get your lab work done. If you're of age, go get your colonoscopy. You know, it's okay.
Mammogram.
And it's okay to question your practitioners. Like, they should be able to have a conversation, sit down and have a conversation with you if you have questions. Anybody that you feel is writing you off, there's going to be somebody out there, somebody better who can do it better for you. So don't let that be a deterrent.
Yeah, trust your instinct if you feel like you are being ignored or written off. Yeah. I think that's a hard thing for maybe a lot of people to do, because they're like, oh, they know better than me. But
they
trust
went to
your
school
gut
for this. Yeah.
Trust your feminine intuition, especially ladies. Guys, pride yourself to death.
Yes.
Pride yourselves to death, men.
No, I have no problem. I have no problem getting scraped and spackled.
God, that's literally what he makes me do. He makes me scrape and spackle his rear end. It's disturbing. I'm like, can you at least shave your butt crack before we do this? This is a.
He's like, no thanks.
I got to use a dog brush just to get through the hairs. Those with 1,000 metal wires.
Listen, I don't want to see either of you two show up in the ER with things that shouldn't be in your butt.
Nah, we always get them out. We always get them out.
Especially under the threat of surgery, you will. You'll go shit it out in the bathroom 5 minutes before rolling back to the OR.
It's wild. He still has a Batman figurine in his colon from 6 months ago.
Christine, have you ever seen that woman on Instagram who does the funny videos about the shit that she finds in people's asses? I think she's a nurse also.
I've probably come across them.
It's amazing. We gotta get her on the podcast.
It's crazy how it's just there's the point of no return, I guess, where it just goes whoosh, and it's just like
it just sucks it
right
those up.
X-rays, it looks like it's punching your heart. Some of these things, I'm like, what is happening?
I know.
We had a guy with an electric toothbrush up his ass, and he was going to have to come have surgery, and he literally the OR was getting ready to take him back, and he's like, I'm going to go try in the bathroom one more time. And he shit it out and didn't have to go to the operating room. And then I was like, I'm not going in. If somebody else is, that is not me. That's not me. Somebody else go get that out of the toilet.
He's like, I just need this battery to die.
We'll have to do a part 2 of what has Christine had to pull out of people's rectums.
Well, the title of this one will be Onions. And the next one can be What's in Your Butt?
Yeah. Awesome.
Well, Christine, even though you're not a coach in this space or anything like that, we like to ask everybody a final question. Have you ever listened to an entire episode of ours?
I have.
Do you remember what the final question is?
I do not remember.
You know why?
Because you never listened at all.
I did too.
Really?
It's been a little while.
Tell me.
I was in the middle of the blue light episode this morning.
The blue light. That's another one there. It's like how blue light affects your health. People are like, "Ooh, does it?" And then the first opening thing, it's like, "This is bullshit." See if you remember this. When I say it, you'll probably remember it. Are you ready?
I'm ready.
Bye.